From a clinical standpoint, I became interested in cardiology basically because it's a very acute care kind of specialty. And patients often have very acute illnesses, and you have to treat them very quickly, and often you save lives. From a scientific standpoint, I was attracted to cardiovascular disease. Because cardiology kind of lagged behind some of the other specialties in terms of molecular understanding of disease. My clinic is actually quite specialized. I'm a genetic cardiologist. There aren't too many of us out there. And what we see from day to day is something that other folks, other providers may see once in their careers or a couple times in their lives. We're focusing on patients and families with genetic disorders that affect the heart. The first thing we can do is identify people who are at risk of having bad outcomes, like sudden cardiac death or heart failure. But more than that, we can actually intervene in many situations. We can actually prevent bad outcomes from happening. If we do find something that was unsuspected in a patient or a family member of a patient who's come to see us, and we know that if they find out about something, it might be traumatic, but on the other hand, it may also save their lives. And that's a great feeling to have. The other thing that really makes my day in the lab is just making a cool new discovery, whether it be a small thing or something really quite dramatic. There are a lot of trials and tribulations and frustrations in both clinical medicine and in science, but that's what we really live for, the occasional gratification we get when we learn something new.